everyone, my name is midwife Sally. Welcome back to my channel. Yes, hope you are doing well, hope your baby is doing well, and hope you are really taking good care of yourself. As I always say, invite somebody to also watch with you. On this channel, we share everything about pregnancy, labor, and delivery. We have a book, Sally's Tips for Expectant Moms. Yes, this book is very educative, has more than 60 topics that are covered. Yes, to give you a clue as to what questions you should ask your doctor, ask your midwife, what you should be concerned about. Yes, and also you can also join our pregnancy class, which is really, really educative. Today, I want us to talk about something that we are all concerned about when we go to the antenatal. Okay, when we go to antenatal, one of the questions that doctors or midwives will ask you, and then you feel that, oh, why is the doctor, why is the midwife asking this question, is that we ask this question, why have you had a previous miscarriages, or have you had previous abortions, have you had anything like that? Okay, so this is why we ask this question, and this is why you should answer. So why do we ask this question as health professionals? Yes, before even the doctor or the midwife would ask you the question, he would demand, the place should have some privacy, some level of privacy. Okay, so it should be between you and the midwife. Yes, and so, or the doctor. If a doctor is asking, okay, and then you are not comfortable because of the midwife who is sitting there, or your mom, or your sister, or your brother, or anyone around, you can just tell the doctor that you want some privacy, and they are going to give that privacy to you. I know those who are watching my country will be like, they will insult you, or they wouldn't give you the ear. But then, it is your right, you have the right to privacy, so you can just ask respectfully that you would be given some privacy to answer questions that concern you. So we are asking this question because assuming a mother or you are pregnant and you've had previous miscarriages, like 3 previous miscarriages, 4 previous miscarriages, we want to know because it would also affect the kind of care that we will give to you. We have something we call cervical circlage. So we give cervical circlage to women who have had frequent miscarriages, especially in the 2nd trimester. Okay, so if you go and your doctor would ask you, have you had miscarriages before, and at what time did they occur? If you give the right information, okay, it always happens within the 2nd trimester, and it always happens within the 2nd trimester, okay, and at this weeks. The doctor knows exactly what to do for you. He may assess your cervix, and if you need a circlage, he will do it for you. In the 1st trimester, there could be hormonal problems, there could be things that are preventing the pregnancy from staying. So the doctor is going to assess all these things and then make a well-informed decision for you. So assuming you've been having previous miscarriages or previous abortions, or you have done an abortion before and the doctor is asking you and you say no because there's no privacy or because you want to conceal the information, he will give you a general care that will not help you. Because until you tell the doctor or the midwife exactly what is happening to you, there's nothing he can do for you. He's going to use the data you have given him to process. He's going to process the information to give you a care plan. And so if you give the wrong information, he's also going to give you wrong treatment. And you wouldn't want to find yourself in that situation. Yeah, so always make sure you answer and give the appropriate answers as your doctor or your midwife has asked. If you need privacy, just ask your doctor, just ask your midwife that you need privacy, so they should grant you privacy, and it is going to be done. You don't need to be afraid, you don't need to be shy and all that. And always make sure that the information you are giving is really correct. As I said, it is your information that we process and give you the kind of care that you require. There's nothing private, and you shouldn't make it too private to your own detriment. Yes, and if you don't want it to be written in your book, you can tell your doctor, okay, I'm giving you this information, but I don't want it to be written in my book because maybe when I go home, there'll be less privacy and somebody will just get to know my history, which I feel is personal. I don't want anybody to know. So don't write in the book that I am taking home, but maybe kept on your records in the hospital. So there's a way you can go about it. It's all about communication. And so that is why we ask about these sensitive questions. Yeah, sometimes we even ask where you stay, the kind of work you do, and all that. It's all to see how we can help you. Example, if somebody sells fish and she smokes fish, and so whilst you are smoking the fish, there's a lot of smoke, and smoke can affect your pregnancy. And so your doctor can tell you about lifestyle modifications. Yes, lifestyle modifications, so that you change some of the things that you do for a better outcome. For a better outcome. Yes, so that is why we ask this very sensitive question. As I said, if you are not comfortable, always ask for privacy. And remember that the midwife or the doctor has no right to disclose your information to any other person that you have not approved of, and you can take the person legally on. So don't be afraid when you're speaking to your healthcare provider, your doctor, your nurse, or your midwife, because they have guidelines, they have ethics, and they have standards they have to work with. Yes, so I hope the next time you go, you would open up to talk to your doctor, your midwife about things that they need to know so that they can give you the best outcome of your pregnancy. Thank you so much. My name is Midwife Sally. Follow us on Facebook and on Instagram. And also don't forget to subscribe to our YouTube channel. Have a great day.